Yeah, my name's David Williams. I'm the practice manager at Westlands Medical Centre. This practice has 10,300 patients. We serve the residents of Porchester, it's a town just between Fareham and Portsmouth. The practice decided to become involved in the pilot. We just thought it'd help with it'd help us in the longer term to get through the inspection. Insofar as preparation that I did and the practice did in advance of the inspection, I can't say we did a great deal more than we were already doing, and we're just continually reviewing our procedures and our systems, and so we didn't really do anything special. The inspection as a whole was a very positive experience, actually. I'd been to a lot of CQC preparation meetings where everyone said it's outcomes driven, and I didn't believe it. I expected them to come looking at my policies and procedures and be stuck in the office asking to see my files. It absolutely wasn't like that. So I was very pleased that they did what they said. The day was actually quite an enjoyable day. The inspector was very polite. She gave us the credit of knowing what we're doing, and she just came along as though she was asking us how we did our job, and it was actually very pleasant. The inspector arrived about 11 o'clock in the morning, and she asked to see me, and she spent 10 minutes with me talking about what her inspection process would be. And she then went down into the waiting room, and she spent well over an hour talking to patients and observing what happened in the reception area. When she'd finished with the patient, she went to talk to the reception team, finding out what they did and how they did it, and observing them answering the calls, answering the telephone, and speaking to patients. After she'd finished that, she came back to me to say what we were going to do next. It just so happened it coincided with all the doctors finishing their morning surgery, and so she sat in our meeting room and chatted to the doctors then for an hour. The nurse came in, our senior nurse, and she developed the conversation with her as well. So it was just like we were just talking about business, but it actually fulfilled her criteria. When the inspector had finished her visit, which was about 6.5 hours after she'd arrived, she debriefed me and she gave us very good feedback. She seemed genuinely impressed by what we were doing in the practice. There was an aspect of feedback the inspector gave me that I was actually very pleased with, because when she inspected our premises and looking at the safety of the premises, some aspects of risk assessment I wasn't up to date on, and I admitted this to her, but she was quite happy about that because she could see that it was safe. And that's the thing about being outcomes driven. She was happy. She could see it was safe. She wasn't so much interested in the piece of paper that said I'd done a risk assessment. I feel we've developed a good relationship with the CQC over this. I've been very impressed by their attitude to the inspections and the way they've carried it out, and the whole process has been very positive for us. Well, my advice to other practices when the real inspections come around is don't be frightened of it. If you're doing a good job and you're well organised and the practice is running, then I'm sure you'll do well in the CQC inspection.